Hello, hi, it's Dr. Erica. Thank you for joining me. On today's topic, I'm going to be talking about gemfibrozil, also known as LOPID. Gemfibrozil is not a popular anti-cholesterol medication, but I do want to go over it just mainly for my own review and to give out that pertinent information for those who may be taking these medications. Usually patients who have a history of coronary artery disease or atherosclerosis, patients who have tried adequate diet modifications, patients who have tried diet and exercise modifications but have not had an improvement in the cholesterol or at risk for myocardial infarction, those who are at risk for also pancreatitis, and also triglyceride elevation. Those patients will be placed on a prescription like gemfibrozil. And there is another medication I just had a video on called niaspan ER. Niaspan ER is also a medication that that will not causes, but is used to prevent the cause of high cholesterol. And it's used mainly for those patients, again, who have tried everything else and still have had a coronary artery episode or myocardial infarction episode. Those particular patients are specific and candidates for gemfibrozil or LOPID and also the niaspan. So do look at that video as well. If you're new to this channel, please like, share, and subscribe. There's a subscribe button that is placed in the small little corner there. Please, and not only visit, but subscribe. Shop online at my website, www.millenniumpharmacy.com. And also please be in the know as new content is loaded to this YouTube platform. So gemfibrozil comes in one tablet form, and that tablet is a 600 milligram tablet, usually dosed twice a day with breakfast and with a meal at dinner. And this particular medication should be taken 30 minutes before the meal. Again, 30 minutes prior to eating dinner and also eating breakfast. Twice day dosing. And its side effect is usually going to be the dyspepsia, abdominal pain, fatigue, nausea, diarrhea, GI upset symptoms is what I'm going for here. Blurred vision as well, dizziness, muscle pain, tenderness, weakness. Don't use this medication if you have a liver or renal dysfunction, liver and renal dysfunction, gallbladder disease as well. Those patients should not be taking this medication at all. And also, there's a drug interaction between this medication and Coumadin or warfarin. So if you're on any oral anticoagulant medication like a blood thinner, you should not be taking or use caution with gemfibrozil. Also, there's one particular specific medication called lovastatin. Lovastatin is also for cholesterol, and it is a medication that interacts with gemfibrozil. When these medications are taken alongside of each other, there's a risk for muscle tearing, muscle tenderness, muscle strain. So do be aware of that particular drug interaction. That's lovastatin and the gemfibrozil. Now, its mechanism of action is that it's going to lower the triglycerides, lower the bad cholesterol, increase the high LDL, which is the good cholesterol. That's the cholesterol that we all want and to have, and that's what it's going to ultimately do. Okay, it has a short half-life, so it's usually peaks in 1 to 2 hours, and then it given twice a day to help um, with that short half-life. So that short half-life determines the maximum concentration in the body. Okay. Now, gemfibrozil is not, again, a medication that's readily prescribed, but if a patient qualifies with the pancreatitis history, a history of coronary artery disease, a history of atherosclerosis, history of myocardial infarction, those patients will have gemfibrozil as an option just because it works best in that particular group of people. There are the statin class of families that is first choice when prescribing, because that particular class of medications lowers the cholesterol very fast and very effective in patients who are not at risk for a recurrent heart attack or a recurrent coronary artery disease, or pancreatitis. Okay, and then again, side effects from gemfibrozil are going to be the dyspepsia and the GI upset, nausea, vomiting, diarrhea, dyspepsia, indigestion. Those are its main side effects because that's where it's going to ultimately begin to dissolve and be absorbed in the body. Okay, and so its what it's mainly going to do is lower the bad cholesterol, increasing the good cholesterol, and that's what we want. But medications are option if you have tried diet, if you have tried exercise and no response, no type of improvement in your LDL lowering or your HDL increase, then definitely you want to go ahead and seek more help through your provider for a pharmaceutical or pharmacotherapy. Now, again, diet and exercise, that's going to be your protein, your fiber, your non-starchy vegetables, your dairies as well, vitamin D through your dairy, and your getting out in the sun. Also, you're exercising 30 minutes a day for 5 days out of the week to help with the decrease in to help with decreasing fat tissue around the circumference of the waist, and also help with getting good cholesterol up and bad cholesterol down. Also, diet and exercise will do it. If you can't get your vitamins and minerals through your diet and exercise, there are supplements that are available as well to help with that. So do be in the know, do be on the lookout. Please visit my other YouTube web videos to help with learning more about vitamins and minerals, exercising, prevention of glucose increase, and also diet, exercise, diabetes prevention as well. And all of those play a role together. They ultimately come together. Bad cholesterol, increased glucose or diabetes, all of those come together. If they're not balanced thoroughly and they're not where they're supposed to be as far as um, healthy wise, then of course we're going to get disease states, hospitalizations, and ultimately fatalities that we can prevent. So we do want to implement those good behavioral habits in our lifestyle. So thank you for joining me on today's topic. I'm Dr. Erica signing off. We hope to see you on the next one. Bye-bye.